What to expect in a pediatric physical therapy session. I know a lot of emotions can come with receiving a referral from a physician or maybe seeking out a referral for your child yourself. And first, I want to tell you, it is awesome to get some extra support and help along the way. There is nothing to be fearful of or worried about or ashamed about needing a physical therapy referral for yourself or for a child. I'm Kelsey Boss, pediatric therapist and founder of Compleo, and I'm here to talk about what to expect when you bring your kids for their first appointment. One, I want you to let your kids know that it's going to be fun. Our job as pediatric therapists is to engage you and your child, make it fun, incorporate games with a therapeutic purpose, but still a fun time. My son came here for therapy and he still asks when he gets to come back, which is excellent in our goal to make it enjoyable for everyone. The next thing I would plan for is to bring clothes and shoes that your child can move around in. Once we had a kid come in two small cowboy boots and we got a completely inaccurate picture of how they could walk and run and move around. So make sure that they're in something that's comfortable for them to run and jump, or if you're working on rolling and sitting, whatever level of skills is your personal goal, wear something comfortable for your child to transition in and out of, and something that they're going to feel confident in. The next thing I would expect is your pediatric therapist is going to ask a lot of questions about medical history, movement history, and it's okay if you don't remember every little detail. So don't stress out if you don't remember exactly which date they met certain milestones. We're just trying to get a big picture idea. But the one thing I want you to be prepared about coming in is you and your child's biggest goals. So if we could wave a magic wand, what do you and your child, include your child in this if they're old enough, want to accomplish in therapy? Is that I had a child whose goal was independent toileting. I had another child whose goal was walking in the walker to be able to stand long enough to be a cheerleader on the sidelines. And if it's a baby, your goal might just be reaching certain milestones. But what would make your life more fun, your life more functional? It doesn't necessarily have to be the checklist of milestones that we have. So that's the one thing I want you to prepare for the most. The other things to expect are some things to work on at home. I always say if you have a jar of marbles with a white marble for every hour in the week and a black marble for the 1 or 2 hours you spend with us, what's going to make a bigger difference, the white marbles or the black marbles? Definitely the white marbles. So we're here to facilitate the process. We're here to give you ideas. We're here to give manual therapy to set your child's body up for success. But be prepared for some environmental suggestions, maybe adjust the car seat this way or put their toys on this side so they look a different side. Be prepared for a few suggestions for home. And if you're not here in Waco and you're going to physical therapy and you're getting 0 suggestions from home, I would recommend maybe interviewing some other therapists. You can expect hands-on therapy. So our mission is evidence-based care, early intervention, and hands-on quality services. And so there's going to be a combination of both manual therapy and exercise, balance, more what you think of as traditional physical therapy interventions. Now, another common question we get is, do I come into the PT gym with my child? That is very child specific. We always want the parents involved if you want to be involved, but sometimes kids do better when their parents are in the waiting room. So that is something you can problem solve with the therapist of what is best for you and your family. That is the benefit of going to a boutique owned small business, sometimes out of network healthcare clinic, is we get to do what is best for you. There's no big rules of every parent has to wait in the waiting room or every parent has to be with their child. We will work with you to see what's best. But for the first session, at least expect to come back so that you can help with history, make sure it's a smooth transition, and make sure your child feels comfortable. That is the most important thing, is that both you and your child feel comfortable and confident with your therapist and that it feels like a personality match. So those are a few things to prepare for your first day in physical therapy. If you have any questions, message us or comment below, and we would love to have a conversation with you.